Do you have constant muscle pain and fatigue? If so, you may be one of the approximately 5 million Americans age 18 or older who suffer from fibromyalgia. For years, the condition has been misunderstood, with many seeing the pain and fatigue as purely psychological, a concept that can be incredibly frustrating for those living with it. Originally classified as a psychosomatic disorder, fibromyalgia was often caused by mental factors, meaning that the symptoms were imagined and not physically real. People with fibromyalgia often report pain in the neck, shoulders, back, and legs, which can be debilitating and seriously affect daily life. Despite the widespread recognition of these symptoms, medical research has long struggled to identify their root cause. However, recent breakthroughs have brought clarity. New research has shown that the pain associated with fibromyalgia is not purely psychological, but is related to the sensory nerve fibers in the blood vessels in the palms. In this video, we discuss these recent findings in fibromyalgia and shed light on the physiological mechanisms underlying the disease. In addition, we explore a series of exercises designed to relieve discomfort caused by sciatica, hip problems, and lower back pain. Whether you're looking for information on how to treat fibromyalgia or manage symptoms, stay tuned for practical tips and expert advice. Before diving into this important information, subscribe to our channel for more daily tips and updates. Don't forget to turn on notifications so you never miss our latest videos full of insights to improve your well-being. Sensory findings in blood vessels. To confirm the findings, the team conducted a second study to see if they could detect pathology in blood vessels that might also be affected. After analyzing skin samples collected from women with fibromyalgia, they found that the number of sensory fibers increased significantly in some blood vessels in the skin. These nerves are part of the arteriovenous shunts, which are responsible for the thermoregulation of our body by regulating blood flow in our blood vessels. In hot conditions, the shunts close, forcing blood to the surface of the skin to be released. In cold conditions, the shunts open and allow the veins to retain heat, cooling the hands and feet. Too much sensory renewal. Dr. Albrecht, the lead researcher of the study, explains that this excessive sensory renewal may be the cause of painful arms in fibromyalgia patients. Since the sensory fibers are responsible for opening the shunts, they become especially active in cold conditions, which are very distressing times for fibromyalgia sufferers. Blood flow. The research team also reached a different conclusion. They explained that our hands and feet usually contain more blood than is needed, so they are used as reservoirs for the blood transported throughout the body. Dr. Rice, director of Integrated Tissue Dynamics, elaborated on his findings. Pathology found in shunts in these hands can interrupt blood flow to muscles throughout the body. This poorly managed circulation can be the cause of muscle pain and fatigue in fibromyalgia patients. These findings are a step in the right direction for fibromyalgia patients. It offers the right treatment instead of conventional painkillers and antidepressants. So if you have fibromyalgia or know someone who does, it's good to finally know that you're not crazy and you can be sure that fibromyalgia is real. Causes of fibromyalgia. Doctors are not exactly sure what causes fibromyalgia. Several factors can work together. Genetics. In most cases, fibromyalgia runs in the family, so there may be a certain genetic mutation that can make you more susceptible to the disorder. Infections. Certain diseases can trigger fibromyalgia. Physical or emotional trauma. Fibromyalgia can sometimes be triggered by physical trauma, such as a serious car accident. Psychological stress can also be a trigger. Just because a new breakthrough has found the cause of fibromyalgia patients' pain doesn't mean they have to stop doing certain things that prevent it from working. You have to continue to take care of yourself and create a program that helps. First of all, you should try to reduce stress in your life. This may mean that you set aside time to simply relax. Adequate sleep is another key issue, as fatigue is one of the most important features. Adequate sleep is essential. In addition, you should try to exercise regularly. It may hurt at first, but eventually it will reduce the pain significantly. Now that you know what can cause fibromyalgia, here are some exercises you can do if you have pain related to medical issues. If you've ever experienced muscle, hip, or lower back pain, it's likely a direct result of sciatic nerve irritation. This muscle pain can spread downward and affect the limbs and feet as well. Many people suffer from this pain, and it can make their daily routines difficult. If you don't know where the sciatic nerve is, it is deep in the buttocks as it surrounds the piriformis muscle. Any muscle contraction or swelling can cause nerve irritation and possibly pain. The piriformis muscle connects the top of the femur to the spine and is the main muscle that supports the outward movement of the hip, lower leg, and foot. However, the sciatic nerve can sometimes pass through this muscle and cause sciatica or piriformis syndrome. Many people take medication to relieve the pain, but that doesn't solve the anger problem and you end up on medication for the rest of your life. Instead, try these incredibly effective pear-shaped stretches. Pear-shaped stretch landing. Start lying down with knees bent, then cross the affected leg over the other leg, bending it up towards the chest. Then, take the knee with one hand and the ankle with the other and slowly pull towards the shoulder. If you do it right, you will feel the stretch through your glutes and glutes standing pear-shaped stretch. This is another good exercise to relieve gluteal pain. Start from a standing position and place the affected leg on top of the other leg so that it looks like the number 4. Then, slowly lower your hips to a 45-degree angle to the ground. Lean forward with your body and extend your hands to the ground, making sure your back is always straight. Next, press the leg behind the knee and turn the leg to the opposite side so that the knee turns outward. Place your hand on your knee and raise your other hand in the air. Then slowly lower your hand to the opposite side of your knee. Long sleeve stretch. Start by sitting on the floor and spread your legs as far apart as possible. Carefully lift your body forward towards the ground and place both hands on the floor side by side. If you want to take it further, try touching the ground with your elbows as you bend forward. Short inner thigh stretch. Start sitting on the floor and bring the soles of your feet together. Hold both ankles with opposite hands and gently press down with your knees, trying to touch the ground with them. If you start to feel pain, stop and take it back an inch or 2. Clams exercise. Lie on your side with your injured hip. Bend your legs back so that it looks like the letter L, making sure that one leg is over the other. Keeping your feet together, lift your top knee up and then slowly lower it down. Shift your weight away from the affected leg and lift it up with the knee bent. Then slowly lower the leg back to the starting position. Lateral pear-shaped stretch. Lie on your back, feet flat, and begin to bend the affected leg upward, placing the foot on the outside of the other leg near the knee. With the opposite hand, gently pull the knee of the affected leg through the middle of the body until you feel a stretch. Make sure your shoulders and hips stay on the ground at all times. Do you have experience with fibromyalgia or another pain-causing disease? We'd love to hear from you in the comments section below. Your insights and experiences can help create a supportive community where others facing similar challenges can find comfort and understanding. If you found this video informative and helpful, please hit the like button and share it with your friends and family. By spreading awareness, you help better understand conditions like fibromyalgia and empower sufferers to seek the right help and support. Don't forget to subscribe to our channel for more in-depth health and wellness videos and practical tips for dealing with various ailments. Turn on notifications to keep up with our latest content designed to help you live a healthier, more fulfilling life. Thanks for watching and being part of our community. Your participation and support means a lot to us. Let's learn, grow, and support each other on our journey to better health together.